a mask today that I got from Cedarville University, and also wearing a Cedarville University tie. Cedarville, we're doing this from our home in Cedarville. Cedarville University is about 2 miles from here, and I actually had the privilege for a couple years of teaching there part-time along with Dr. Mark Smith. Taught some courses in political science, so that was a lot of fun. The room we are in, some of you may recognize the room, is actually where I was sworn in. And this room was built by Fran's two brothers, Ken and John Struing, and they're great builders and did a great job. And we enjoy the room a lot with our kind of a place for our family together. Yesterday was a kind of a crazy day. I just saw this. Kind of a crazy thing to take a look at for me anyway. But it was a kind of a roller coaster day, as I indicated last night. We started here, went to Cleveland, went to Case to get a test set up by the White House, took the test, left and went to the airport and fully expected to be going in to see the president. Did not have that opportunity because they told me that I couldn't see the president, and the reason was that I tested positive. So that was quite a big shock. By the way, the president called me today. I appreciated that very much. I wanted to see how I was doing, and he said he had been told last night by Secret Service that I was actually tested negative. So he was just calling to see how I was getting along. We had a good conversation. So I came back and got a test. I talked to Dr. Andy Thomas at Ohio State, who we have had on here before. He's helped us throughout this pandemic in dealing with the coronavirus. So I called him, and he set up a test. So Fran and I and some of the people who work directly with me every day, Eric, who's behind the camera there, was one of them, and took the test. And then we went home. We came back here to Cedarville and just waited and waited. Fran fixed me some chicken and rice soup. I think she thought we're settled in for the long haul here in dealing with the virus, and that's what we thought. But then got the good results last night that the test from Ohio State had come back as negative for all of us. They told us they wanted to rerun it just to double check. They reran it. A few hours later, we got a call that those tests had come back negative as well. So we're very happy, obviously happy about that. Later this afternoon, we'll have Dr. Peter Moeller, Chief Scientific Officer of the Ohio State Wexner Center, who will talk about the tests, not my results, we have my results, but we'll talk about the different types of tests that are done. The test that I had in Cleveland is the Antigen Test. It's a relatively new test. It's a quicker test. The gold standard is what we did at Ohio State, and that is the Pcr test. So I'll leave it to Peter, Dr. Moeller, to really talk about that. Let's go, Eric, to today's daily summary. We're kind of seeing some stabilization really in the cases. We would love to see them going down more, but they're running anywhere from 1,100 to 1,500. As you can kind of see by the up and down of this over the last 21 days. If we look at the rest of it, nothing, every time we see deaths is tragic, 34 deaths reported. If you go down to the hospitalizations, actually this is consistent we've seen some downturn in hospitalizations, which is certainly a good thing to see. ICU admissions running about flat, kind of up and down every day. So that's where that is. Let's go now, Eric, to kind of the map of where we are. This was released yesterday. You've really seen some changes, and we'll talk about that in a minute. We have 11 red counties now. Mercer County is our only new red county. The others are Allen, Cuyahoga, Erie, Fairfield, Franklin, Licking, Lucas, Marion, Medina, and Montgomery. We've seen some positive movement going in the right direction, which we like to see. Henry County, Lawrence County, Hamilton County, all are no longer red. It's particularly significant, significant for all three, and I congratulate the communities. Hamilton County has been red all the way through this, and they've come off that, and that's certainly what we hope for all the red counties. Hamilton County is really a success story. The business community came together, Mayor Cranley, the county commissioners, everybody kind of pulled together, got the message out. Mask wearing is just vitally important. And the percentage of people in Hamilton County wearing masks out in public went up dramatically, and everybody got behind it. So we've seen some great results there. Very, very happy about that. We know the battle is not over. Hamilton County residents continue to wear the mask, continue to be smart about the social distancing, and just be careful. Hamilton County is still a fairly high number, but it's certainly a lot better than it was. And as we said, Hamilton County, it's great to see down here, the red is gone from that part of the state, or at least that part. Let's go up to a few other counties. Allen County, a group home outbreak jumped from 11 cases last week now to 13 more this week, for a total of 24 associated with the outbreak since mid-July. Typically, the average number of cases they report every day is 12 to 13. They had 117 cases during the past two weeks. Cuyahoga County, still red, but seeming to do better. They had a steady decrease in daily number of cases reported. And again, to folks in Cuyahoga County, thank you. Wearing the mask and keeping the social distance. They still, though, exceed the CDC's threshold for a high incidence, which is 100. They're at 114. During the course of a week, they dropped about 40 cases a day. So real movement in regard to Cuyahoga County. Erie County. Erie County cases remained elevated, although they had initial outbreaks associated with Put-in-Bay. The virus continues, unfortunately, to spread throughout the community. Down in Central Ohio, Fairfield County continues to have a high number of cases, 121 per 100,000. An outbreak in a long-term care facility has 14 cases so far. Informal gatherings also are driving increased case numbers. And again, that's what we're seeing, frankly, across the state. It's these informal kind of get-togethers. Franklin County continues red this week, in part because of new outbreaks related to restaurants, long-term care facilities, and a healthcare facility. Licking County. High number of cases is being driven by a church gathering that had 42 cases, and long-term care facilities also with significant numbers. Up to Lucas County, several outbreaks in Lucas County have contributed to high case counts. They include outbreaks at a daycare center, a local university, and a camping outbreak related to camping. Their numbers are high at 189. Now, Marion County. Marion County is close to dropping off red, but not quite there. Long-term care facility in Marion County has more than 60 cases, half of which were linked during the past week. Medina County, Medina cases are increasing, unfortunately, in part related to cases associated with the manufacturing plant and family trips out of state to hot spots when they're bringing it back to Ohio. Mercer County. And Eric, why don't we switch over and we'll look at the counties in the row that we've put them. I'll just finish here. Mercer County, very, very high, 262 cases per 100,000 residents in the past 2 weeks. You'll see, this is the whole, you'll see the whole chart. Unfortunately, Mercer County is at the top of that. And we'll get to Mercer in a minute. Montgomery County, we'll go down to Southwest Ohio. Montgomery County remains red this week. In addition to community spread, they've had outbreaks in long-term care facilities, workplaces, and again, the family gatherings. So Eric, let's look at the top 10 counties. And again, this is what we did. We put these, I asked our team to put these in order, and you can pull those down from our webpage, all 1 to 88, all counties ranked. And again, what this is, to remind everybody, what happened in the last 2 weeks, how many outbreaks, but then it's reconfigured based on population. So if you take it by population per 100,000, population, unfortunately, Mercer County is way up there at 262. You'll see Lucas, 189. And if you look at these, what is, it's disturbing when you see any county. But what we're seeing is that the more urban counties where mask wearing is become very, very, very prevalent. It's the norm now by far. We're seeing a plateau and then starting to go down. In many of the rural counties, we're not seeing that. As you see more of the orange counties in the map we showed a minute ago, it's just spreading out into the rural counties. And if you look at the top 10 hottest counties, unfortunately, you go through these and there's some small counties in here. Mercer County is one, Wyandotte County, Champaign County, Hancock, Darke County, Fairfield, Erie. So these are just no longer are they your big counties where the high concentration of people close together. These are the more rural counties, and it's of frankly grave concern to us. Let me just talk about a little bit about Mercer County. They're red for the first time this week. They're showing an increase in patients in their emergency department, which is worrisome, according to local health officials. Now, Mercer County has had some significant big outbreaks. You can go way back in May, an outbreak on a farm, I think had 80 cases, 51 cases from an event, a funeral. 33 of those individuals were actually from Mercer County and brought it to Mercer County. But what's probably more significant or equally significant is that this is now spread to the community. Today, the virus is spread all over Mercer County. Their health officials tell us that it's in all corners of the county and is affecting people of all ages. So again, my plea to my friends in Mercer County, and it's a wonderful, wonderful county, is wear a mask, keep the distance, is the only way that we can slow this thing down. And we just ask them to please do that. Let's turn to Athens County. Athens County, some good news. Athens was on the watch list for risk of going red to purple, highest level on the alert system. They had several outbreaks at bars and restaurants and informal gatherings. This week they're yellow. They go all the way down to yellow. Their county health officials told us they're seeing many more people wearing masks. They also said they're discouraging smaller gatherings and have encouraged people to limit their contact with others. The residents are doing what they can to protect themselves and others. That's just great. Staying home when they can, hand washing, social distancing, wearing a mask. So all of these things for across the state of Ohio are what we obviously need to be doing. Next week, we will be making some announcements. Sometime next week, Lieutenant Governor and I will be about sports in Ohio. We're going to talk a little bit about professional sports, college sports, and of great interest, I know, by the number of calls I get and emails I get, what we're doing about sports in high school, junior high. And so we'll have guidance in regard to that. One of the things, let me just say, and we'll talk more about this next week, but when we talk about our students, when we talk about our student athletes, I truly believe that the schools are doing absolutely everything they can to protect our students, whether an athlete or not an athlete, whether they're in drama or whatever they're in. I think that whatever their interest is, all the students, our schools are getting ready and doing absolutely everything that they can. One, as I talk to superintendents, one of the concerns is, what young people do when they're not at school. And again, I think this is an opportunity for teachers. It's an opportunity for the principals, superintendents, for those who are in athletics, coaches, for those who are in other service clubs or other things, whoever teacher is running that and is in charge of that, to talk really to the students about the rest of the day when they leave, and how careful that they need to be. One of the grave concerns that we have is when schools open back up, that we have people who are vulnerable. It may be someone, it may be a child. It may be a child at home. It may be an adult at home. Maybe a diabetic father, maybe a mom who has some other medical problems, maybe a grandparent that's living in the home. And so for those students, when they go home, to be very, very, very careful, and to, not just when they're going home, but when they're out with their friends, to wear a mask, to be careful, because the people who are really vulnerable are the ones who have a medical condition. It would be the same way in the schools. I know our superintendents are working very hard, our principals, teachers, everyone, to try to figure out if there's a teacher or someone who has a medical problem, custodian, someone else, how best to help them, and to isolate them maybe, or in some way protect them. So we are all in this together, but I really believe that what teachers, what coaches, what others say to their students over the next few weeks is really going to determine to a great extent, how well we do and if we're able to go back to school, because I think the schools will do it well. I think the students will do it well in school. The question is, when they get out and they're more relaxed in informal situations and social situations, are they being careful? And it's just very, very, very important. Let me give you a update in regard to tracing. Tracing is run by 113 health departments around the state of Ohio. We are working very closely with them. We have extra tracers that we have hired and employed. They can surge in. For example, in Mercer County, we have some who are helping there, and some other counties. But one of the things that we've been trying to do is get better data. And so I was asked last week in a question to provide some additional data about contact tracing and the outbreaks and the stories and where the stories came from that we've been sharing. I've talked to our team at the Department of Health. Data related to outbreaks is frankly, under the current system at the Department of Health, not very easy to get through the Ohio Disease Reporting System or the Ohio Contact Tracing System. And let me talk a little bit about why that is, and then about what we're doing to help. Neither system was designed to pull data out. Neither system was designed to data mine, which we all just take for granted that we want to be able to do. And so I know some of my friends in the press have asked for information that we've not been able to provide. They may be frustrated. I am even more frustrated because I'm asking questions every day about where we're seeing outbreaks and information. And so the data systems that we have, one of the systems is 19 years old when it was designed. I'm sure it was state of the art then, but certainly is not state of the art now and does not do everything we want it to do. This is an example of, frankly, the decades underfunding of public health. And when this is all over, as we look to the future, now as we look to the future, we've got to do a better job and frankly invest more in public health at the federal level, the state level, and at the local level. And my commitment is that we will do that, and we are doing that. The Ohio Disease Reporting System, for example, was designed to look at outbreaks by broad categories. Is it foodborne or is it hospital acquired? And not by setting. It doesn't index outbreaks based on the exact kind of business setting, such as a bar or a restaurant or a grocery store. It doesn't tell us that. That information is generally entered by local health departments in a field that isn't easily searchable and isn't always entered the same way. Consequently, we aren't able to pull a comprehensive list of outbreaks by specific setting. What we do is kind of bypass that system and go directly to the health departments and try to get as much information as we can about what is occurring and where the outbreaks are occurring out in the community. And you can tell every week when I talk about that, we've pulled some of that down. The stories that we talk about every week are anecdotal stories that we have collected from the local health departments. We know it's incomplete, but it does help, I think, provide a clearer picture of what is going on. Additionally, these stories often give us more detailed information about an outbreak and demonstrates the true spread of the virus. Let me now go on. Let me keep us moving here. Eric, let's pull up Dr. Peter Moeller, who is coming up. We're pleased today to have Dr. Peter Moeller join us. He is the Chief Scientific Officer for the Ohio State University Wexner Medical Center and Vice Dean for Research at the OSU College of Medicine. Dr. Moeller has been working with our team for the past few months to help us on our testing strategy, and we're grateful for his work and expertise. We're grateful for him being here today. Doctor, thank you for joining us. And I wonder if you could just talk a little bit about the different tests, because I know that what happened with me yesterday has caused some questions, and people are asking about it. My understanding is that I was given up in Cleveland at Case an antigen test. Later on at Ohio State, I was given a PCR test. And I wonder if you can maybe start off and just kind of explain what those differences are and anything you think that we should know.
Yeah, absolutely. So first, thanks, Governor, for having me on today. And certainly science is complex and testing is equally as complex. And so I'm going to break these into two different categories of testing and equate them to a high-power telescope and a pair of binoculars. And so I'm going to first focus on the high-power telescope. So when we think about the testing that we've typically been doing across Ohio, we call that PCR testing. And this is an incredibly sensitive and incredibly accurate, like a big telescope, way to look at the virus. It actually looks at the genetic makeup of the virus, looking at the RNA, and amplifies it. So even a very small, minuscule bit of the virus can be amplified. And because of that, it can be very sensitive. The advantages obviously are we can detect very low viral loads in people that may be either symptomatic or asymptomatic, and we have the ability to be able to look at this over time. The disadvantages obviously are things like, it's hard to scale this. It's hard to have lots of different high-powered telescopes across the country, across the state. It takes a certain type of person to be able to run them that has had training. But when we get a result from the PCR test, similar to looking at a star with a high-powered telescope, you get a very good impression of what's happening at that level. Now, I'm going to contrast that in a second with the antigen test, the test that you had yesterday. So very similar to a pair of binoculars, you're able to look maybe not at the level that you would look at with the PCR test. So the antigen test doesn't look at the genetic material. It actually looks at the protein on the surface of the virus. So it's a little bit less sensitive. And so you're going to have things that we call false negatives and false positives. Like binoculars, you're going to miss some stars. But the good part is you're going to be able to have lots of these across the field. And the key point of what we call point of care testing, which these enable, is that you can find out results within 15 or 20 minutes. And so for the epidemiologists of the world, you're very quickly able to do contact tracing, be able to quarantine people, and be able to make decisions on healthcare. With all of these tests, though, it's important that we understand their strengths and limitations. And so in the case of antigen testing, which is a newer type of testing to the state, we want to make sure that before we would roll this out for our state labs, we would understand really the benefits of doing it and also some of the disadvantages. So in the state, we've done almost 1.6 million tests using the PCR test. So we know really a lot about it. We're very familiar with the strengths and weaknesses. With the antigen test, it's still a new technology and we're getting to learn on it. we've been empowered by your team to be able to really study it, to figure out how it's going to work best for the citizens of Ohio and how to implement it as part of our strategy.
Well, thank you very much. Are there other quick things that you might call a quick test that are a PCR test?
Right. So we've often heard, and
I'm excuse me. I guess the question, I think the assumption might be that every quick test is the same, and so maybe if you could just kind of explain that to us a little bit.
Yeah, that's a great question, Governor. So there's two types of quick tests, and these are tests that can be done sort of in 15 or 20 minutes. The first that I just mentioned is this antigen test, and basically it's a swab of your throat or your nose and gets put in this machine and says yes or no. The other way, though, is we've heard that a lot about these Abbott point of care tests. So this is still a molecular test like the PCR test, detecting the RNA or the DNA of the virus. And this is often done, like right now in the emergency departments, as a way to really triage cases. It's still a very accurate test, but not quite as accurate as what we would do in a CLIA lab, like we're doing here at the Wexner Medical Center with Patel.
So if you had to rank those, then rank them in the order of the most accurate.
Yes, sir. So we would call the gold standard to be the PCR test, and this would be the test that was done twice on you last evening. And again, this is going to be the one that gets at the very detailed look at the DNA or the RNA. So the big.
And doctor, let me interrupt. That's the test that for virtually everybody who's watching this who has had a test in Ohio, they probably have had a PCR test. Is
yes,
that right?
Sir. So the vast majority, well over 90% of the people that have been tested in Ohio have used the PCR giant telescope test, sir. And this again, gold standard. And I would say even beyond that, it's the best and most accurate test right now in the world.
Okay, I interrupted you. You started that test, gold standard. Then what would be next as far as accuracy?
Right. So you would probably put next your point of care Abbott ID type of test that you would get tested in the emergency room. Still quite accurate, a little bit faster. In fact, quite a bit faster than the PCR test. It takes sometimes hours, and we've seen some backlogs of days. And then next to that, Governor, below that would be some of these things with like the antigen test that you took yesterday morning. So again, very fast, pretty accurate, but again, not quite as accurate as the PCR test that you took last night.
Now, we've been talking, Doctor, with a company that is doing more talking. We've entered a contract with them, a company that uses saliva. It's a California company. The saliva can be administered. The advantage it has is a number of people. It's self-administered for people who can do that, and you could do it in a group, and people would do it, and then it gets mailed to California and comes back. What kind of test is that, if you know?
Yes, sir. So specimen collection, and this would be whether it's saliva or a nasal swab, is really irrelevant in terms of what test it uses. But typically what we're doing in Ohio is PCR based. Again, this very, very accurate test that gets at the very small pieces of DNA and RNA. The other thing, Governor, that if you don't mind me mentioning, is that we're beginning to start pilot processes to be able to do what's called pool testing. And so this is this process of being able to look at samples together. Because the technology has advanced in a way that we can measure very sensitive amounts of DNA or RNA, we may be able to put 5, 10, or even 15 samples together. And the benefit of that, we've heard a lot about issues with supply chain. We've seen a lot of issues with turnaround times. This will allow us to save reagents, to speed up our turnaround times, and really to be able to change the way we test as a state and really redefine our testing strategy, which is exciting.
Well, it is exciting. And Doctor, I first found out about this when I was on a call with the Vice President, probably 3-4 weeks ago, and they talked about pool testing. I know what they're talking about. Then I found out, talked with you. And so if anyone's not familiar with the pool testing, and correct me if I'm wrong, Doctor, but you could take, let's say you took 4 people or 5 people, you put them in, you put them all together, you tested them. If it comes out negative, you've cleared 5 people. Now, if it comes up positive, then you got to go back and take that samples that you already have and do that testing. But in a state like Ohio, where we're now running about 5.5 or 5.6, something like that, percent positivity, it probably makes a lot of sense. If you're out there certainly with people who don't have symptoms, it would make a lot of sense to do that, I would think.
Yes, sir. And in fact, if you're looking at asymptomatics, where right now, if you think about a prevalence of less than 2% or even 1%, it might even allow you to save about 80% of your testing capacity, expanding 1 to 5 or 1 to 10. So it's really it's something that's going to be a game changer. And then the really great part is a lot of that innovation that has pushed that is happening right here in Ohio. And whether it's creation of new protocols to be able to do this, partnerships with companies to be able to allow us to move forward, or even relationships that you and the Lieutenant Governor have set us up with the CDC and the FDA, as well as the White House, have allowed us to really get out in front of this as a state.
Well, Doctor, thanks for everything you've done. Thanks for coming in today. We may need you for some questions that I can't answer, but we appreciate it. Thanks for what you do every day for Ohio.
Thank you. And I just like to thank all the people in the labs that are doing these tests every day.
It's a huge effort, and they're working very hard, and they're working hard all over the state. So we're very grateful for that. Thanks, Doctor. Thank you very much. Let me turn to Lieutenant Governor.
Well, hello, Governor.
Yeah, there he is.
Yeah, great to be with you in a video connect today. We're used to doing this in the same room, but we're apart today. We've done these news conferences in a variety of settings in a variety of different ways, and it continues to evolve. But I wanted to give we know that people across the state are paying attention to what's happening with schools, and schools are preparing to go back, and parents and students are in anticipation, while many of them want to do it in person. There are some schools who are going to open either in a hybrid model or in distance learning. And we also know that even in schools that are going back 5 days a week, there are some students who either themselves or their families are immunocompromised. And so distance learning is a really important component of what's going to happen in Ohio during the course of the year. And we announced a couple weeks ago of a $50 million grant program that we were putting together to help schools, to help support schools in the costs of providing services to those students who either don't have access to the internet, that they maybe can't afford it. There are a variety of reasons that students struggle to connect with distance learning. And we're going to be rolling out applications for that grant starting on Monday, August the 10th. That's when schools can start applying. Reminder, this is for home internet, hotspots, cellular enabled devices, public Wi-Fi, and mobile public Wi-Fi services. And again, we're targeting those vulnerable populations of people who are living in poverty, maybe have chronic health conditions or no internet access. A little change from where we started this conversation 2 weeks ago. We listened because we had a lot of schools that said, because we set it up as a matching program. Those schools, many of them couldn't find the resources to do this as a matching program, so we've discontinued the matching requirement. We're going to target, we have $50 million. It's a lot of money, but it's not going to be enough to probably serve everyone. So we will target it to those who need it the most. The application period, well, I mentioned the application period, but I also want to say that this will cover purchases that schools made starting July 1st. So if they've already made these purchases, you're not going to be punished for being proactive. You're still eligible to have some of those costs recouped if you've made them since July 1st. The application period will be open through Friday, August the 21st, and then the schools will be notified of their awards on the week of August the 31st. While this is not live yet to apply, we will have it up by the end of the day. Governor, we're going to put this on your social media accounts, the site address, and my social media accounts. It's going to be at ohio-k12.help/broadbandohio-connectivity-grant. That's a long web address, so that's why we're going to post it out there so people can find it and see it and been able to access to do those applications. Another thing that we have done to help schools so that they don't have to go out and try to purchase this stuff all on their own, we've done a request for information. We've had 12 companies so far respond to that, which publicly will show us the prices that they're going to offer for schools and students. This is available at procure.ohio.gov. Again, to get into the detail of this, of where all these prices are on this big website, we're going to post that data out on your social media and my social media so that everybody can see what the prices are, so that we're getting the best deal, make this money go as far as it can for the students and the schools, make this $50 million and the other money that the schools are putting into this go further. We're trying, we're all pitching in here, schools going back in a variety of ways. We know that we've talked about this on the news conferences before. You know, when we get into the winter, we're expecting that this virus might get tougher than it is now. So we know that preparing these students and schools for the future of potentially having to do distance learning is important. And these monies have been set aside, and these prices are now being published publicly so that we can get the best deals possible and make sure that if you have to do distance learning, that you can do distance learning. So with that, Governor, I'll kick it back to you.
Good. Look, that's very exciting. As we all know, the kids, we worry about all our kids. We worry about kids, particularly if school can't be in person. Kids having the ability to get to the internet is so vitally important. So we're excited about this program. John, thanks for heading this up and taking the lead in it. We're ready for questions.
Governor, your first question today is from John Reed at Gongwer News Service.
Good afternoon, Governor. I'm glad you're doing well. As you know, Congress is still working on the next relief package, stimulus bill. Is there anything in particular that you've been lobbying to include in that bill? And would you like to see a further increase in federal share of Medicaid spending?
Well, the Medicaid spending is a huge issue for us because if things are not changed, there's a cliff out there that we're going to get to at some point. So yes, we like that Medicaid side. We want to make sure, we have enough funds for the testing to get through this. Testing is not cheap. We're doing everything we can to keep the cost down. We're building up our own infrastructure in Ohio, which certainly saves money, and we can also control it. But the level of our testing needs to go up even more dramatically than it already has. So the testing, and again, the flexibility for our local communities, for our local mayors, our local counties, and for us is just vitally important. So I'm an optimist. I think they'll get something worked out. I spent some time in Washington. I understand how it works and sometimes doesn't work. But I think something will get worked out, and we'll keep moving. We also have the unemployment extension. We've got people who are out there who are really going to be hurting unless some compromise gets worked out and something gets passed. So thank you.
Our next question is from Ben Schwartz at WCPO in Cincinnati.
Good afternoon, Governor DeWine. Happy to hear you're in good health. I'm wondering, though, if you can comment on the ordeal that you went through yesterday and how it makes you think about average Ohioans who have gone through much more to be tested for COVID-19. It seems like you were in a lucky position to be able to be retested and go from a positive test to negative in the same day, and most Ohioans don't have that luxury. I know you spoke today about progress in testing, but I'd like to know if yesterday's ordeal has had much of an effect on how you view it in the state.
Well, sure. No one can go through that experience without having some impact on you. And, you think about, anybody that goes through that. It was a roller coaster yesterday. Ben, the only thing I would point out, though, is that the majority of Ohioans, we don't know the exact number, but well over 90%, the test that they got was the PCR test, which is the test I ended up with at Ohio State. And so what it does say to me, having to, drill down on the difference between these two tests and understand it better, is that when we deploy an antigen test, we got to think long and hard exactly how we're going to deploy it. And it has certain advantages. We know what the advantages are, but we also know the reliability is not nearly as good as the PCR test that most Ohioans have had. So, we've entered into an agreement with Maryland and other states to start looking at this, but it's a conversation, frankly, I'm going to have with Governor Hogan. I meant to call him this morning, ran out of time. I'm going to call him later today. So you learn. Look, you learn every experience in life. You learn, and so going through that experience yesterday, pushed my head down right in it and said, "Hey, let's look at this reliability of this test." So, yeah.
Our next question is from Laura Bischoff at the Dayton Daily News.
Hey, Governor. I was wondering if you could give us an update on the random sample test that I think Dr. Acton talked about maybe as far back as April. This was to check on what percentage of the population might have the antibodies. Did that ever get off the ground?
Yeah, it did. It's been an area of frustration that didn't move faster. Laura, I don't have that today, but we can get that to you after the press conference, and I'll get it to everybody. It'll be available to anybody else in the press corps after the press conference. We've got that. We can tell you where exactly that is. I just can't do it now. I don't have it in front of me. So,
thank you.
Thank you.
Next question is from Jack Windsor at WMFD in Mansfield.
Hi, Governor. Grateful for answered prayers today, sir. I'm glad you are well.
Thank you.
You're welcome. Lengthy question. Please bear with me. If I told someone the brakes in a car may go out 30 to 60% of the time, I don't know many people who would get in. If we told someone that an airplane would experience failure 15 to 20% of the time, I don't know anyone who would get on a flight. Yet tests are the vehicle carrying kids into person schooling, sports, and adults to work, and business owners to revenue. Yet as yesterday proved, antigen tests have false positives. And if I remember correctly, this is the type of test earlier in the week we talked about buying to administer in the future. And according to the Knox County Department of Health, antigen tests can return false results 30 to 66% of the time. And PCR tests, the one seen as more reliable, can have anywhere from 15 to 20% false results, and are so sensitive that they can report positives up to 3 months after the fact and well after someone is contagious. Yet tests continue to be the primary driver to public policy. And these faulty tests are putting kids in compromised learning environments, driving up suicides, drug abuse, and depression, while wiping out businesses by the thousands. Governor, is it simply time to admit that we bought a lemon and it's causing more harm, this mechanism, than the virus? And is it time to free Ohioans so we can get back to normal life?
Okay, I'm going to reference over to Dr. Peter Muller, who I believe is still on. Eric, is he still on? And I'll just start. First of all, we didn't choose the test. The antigen test, again, is not something that we're using. It certainly has not been so far part of our overall strategy. We have looked at it as a possibility in the future, but the standard PCR test is the gold standard. And, I will disagree with you at least, but I'm going to let the doctor answer the question in regard to what how good he talked about the antigen test, but the PCR test, how good that is. Dr. Muller, you on here?
Yes, sir. I'm still on.
You want again kind of give us the how accurate is the PCR test as far as we can tell? What do you know? What's the data, as well as and then do the antigen test.
Sure. So absolutely. So I think that the first and foremost that a year ago we weren't testing anything, and the science is moving incredibly quickly. PCR has been around for 20 to 30 years, and that technology is tried and true. We know the sequences of the virus. We know the sequences specifically of this virus and how it changes. And we've been able to design these tests so they're almost 100%. So I would probably challenge you on your number of your your accuracy of your PCR data that you just brought up. Now, antigen testing is brand new. Brand new. There's two manufacturers that make it, and we're still learning. And I would say, you know, I don't work for the state, but I will tell you that when we're looking at tests to use for strategies, whether it's here at Ohio State or with my colleagues at other state universities, we follow the data. And before we would employ something into our testing strategies, we look exactly at the questions that you asked. You know, what is the benefit of using this test? What are the risks of using this test? Are we putting people in a false sense of security by telling them things? And so those are all areas that we deploy, and there's not just one person that looks at this, there's hundreds of people that look at this. We look at this in peer-reviewed literature and ultimately come to conclusions about how do we want to change our strategy and how do we want to evolve. I will also add at the end is that we continue to work on ways to improve testing, ways that we can make sure that our PCR testing is expanded so we can include more numbers, ways that we can take an antigen test and make it more accurate. So all of this is evolving in real time. It's exciting time to be a scientist, but we need to come up with solutions where there's data behind them.
Okay, thank you very much. Thanks, Jack.
Next question is from Farnoosh Amiri at the Associated Press.
Hi, Governor. Thanks again for taking the time today to talk to us. My question is, I have spoke actually this morning to the manufacturer who administered the test that you took yesterday before you went and met President Trump, and they told us that it has 100% specificity rate, and the FDA says it has a 97% sensitivity rate. So according to those numbers, that's as good as PCR. So what are the chances that the test results that you took yesterday and afternoon, the two tests that you took, are a false negative?
Well, I'm a biased observer, so I'm going to go back to Dr. Peter Moeller and let him answer the question. He's a lot more qualified than I am to answer the question, and I'm the subject, so I'm probably not very, very biased. I sort of like the negative result, but Doctor?
So I obviously can't comment on the governor's specific case, but I will tell you that if you were to ask 1,000 people that are in my line of work, which is the more specific and accurate test, that all 1,000 of them would tell you that the PCR test that we ran last night is by far more accurate. And in fact, we ran it twice. So we ran it on a duplicate piece of equipment and got the same information. And so we fully stand by the data that we created last night.
Thank you. Thanks.
Our next question is from Jeff Reddick at WSYX in Columbus.
Hi, Governor. Thanks for the opportunity, even from afar today. You mentioned earlier about the state's equipment for public health reporting and data, and that one of those is coming up on 2 decades old, which obviously a computer from 2000 is a lot different than 2020. How did it get so old? Why is there no process, or is there, to update this equipment? Clearly it's needed, and what we have is underperforming, as you said.
I think the answer is pretty simple. We have ignored, as a people, Democrats, Republicans, we have ignored public health. We got to stop ignoring public health. This ought to be a real wake-up call for us. We've got to understand the role of public health. We have people out there in 113 health departments every day, and you never think about them unless something goes wrong. They're the ones that are out there to make sure that we're safe, make sure everything is going right, and when it's going right, we never think a thing about it. So it is a focus on public health. When I hired Dr. Acton, one of the things I said to her is we got to start focusing on public health. Had no idea, of course, that we were going to be into a pandemic. So we got to fix these systems. We got to get them up to date. Look, we can't even tell you, the health department can't even tell you today the number of flu deaths that we have. No, it's just ridiculous. I mean, all this data, we just got to get better data. We've got to get it built into the system. And part of the reason it's difficult, is you're relying on so many, in a decentralized state like Ohio, you're relying not only 113 health departments, you're relying on 88 county coroner's offices, you're relying on a lot of different inputs. And so we've got to design a system, which we will, for the 21st century. So we are in the process. We've done a lot in the last 4 or 5 months. We weren't even integrated very well, if at all, with the hospitals. We're now integrated so that we can show you data up here about hospital admissions, et cetera. So we've come a long way, but we still have a long way to go.
Our next question is from Joshua Rutenberg at Spectrum News.
Governor, glad you're doing well. Question I have for you, it was actually goes back to an earlier question you were already asked, but talking about your ordeal yesterday. Are you worried just about the perception of your results getting back as fast as possible versus average Ohioans who sometimes have to wait days and sometimes weeks? And also my follow-up, another question I have is, if the president is using these antigen tests, which the doctor ranked as the lowest, is he not getting the best information himself for the people that are around him?
Yeah, well, first of all, sure. I'm concerned about that perception. We made a decision that I was either, as the governor of the state, going to be confined here and limited to what I could do for 14 days, or we'd try another test. And so we did another test that was based upon medical advice from Dr. Annie Thomas. And so we got another test. And yes, we did get it back quick. So I agree with that. Again, the vast majority of Ohioans, 1.3 million tests that have been run, virtually not over 90% of those are in the PCR test that I had last night. And there'd be no reason that I think medical professionals would doubt the outcome of that test. So the test that we took, medical professionals, because they told me, we doubt, we don't know if that's accurate. It's probably accurate, is what they told me. It's probably right, but you probably ought to go to the gold standard. Let's go get the gold standard test, the PCR test. I don't know. My understanding is, and I don't know all the facts, but the Republican National Committee apparently contracted with somebody to do this testing. They did the testing. I do not think, but I don't know, I think what the White House does at the White House is a different test. But I can't swear to that, but that's what I've been told, that it is a different test at the White House. If you go see the president at the White House, my understanding it is a more gold standard test than this test. But I'm sure that enterprising reporters, you guys will figure that out and report it. I just don't know. I don't know the answer. So.
Governor, it's John Husted. I got a little report back on Laura Bischoff's question. The Department of Health has completed their sampling for this serology testing to determine whether someone has antibodies that would help us understand better how many people may have had COVID-19. Those should have preliminary results in a few weeks, with a final report in early September. And so we'll be very interested to see what happens there. I will also remind folks that the American Red Cross has been doing these tests when someone donates blood, and the results have varied from week to week, but they are in the range of 1.4 to 1.8% of people who give blood who have these antibodies. So it's based on that data, it's a small number of people when you consider it as the overall population. But the Department of Health will have that data back and have a report by early September.
Good. Lieutenant Governor, thank you. Next
Governor,
question.
your next question is from Jim Province at the Toledo Blade.
Hello, Governor. It's good to see you. Could you give us an idea of what kind of test it is that the state has entered in a multi-state purchasing agreement with? Is that this California company, and is this test similar to the one that you took in Cleveland? Also, do we have any idea what kind of cost is associated with this purchase?
We have not entered into any contract. What we've simply done is gone together as states and bound together to work together to be able to purchase. I think this type test is one of the tests that we've been looking at. Some of our people have talked to both of these companies that do it. But as I said earlier, when we dig down further, and this is something I'm going to talk to Governor Hogan of Maryland and the other governors about. And, again, this is something that we will rely on the professionals in Ohio to make it, not just from the health department, but outside the health department, to see if a test like this, does it have a place? And, again, looking at this and looking at the false positives and the false negatives, and I'm an example of one of the false positives that would appear, certainly would cause us to take a second look and a third look at this. So we will keep you informed, and if we get to the point where we're going to enter into a contract, we certainly will let you know what the cost is. I mean, one of the things I would just let everybody know, this testing is an essential part of what we do. It's not as important, frankly, as distancing. It's not as important as wearing masks, but it goes with everything. We got to cut this thing off, and the only way you do it is with testing and tracing. So we have explored a lot of possibilities, a lot of different companies. We're in the process of building our own system so that we, quote, own more of this. It doesn't mean we own the lab, but we own some of the capacity in the labs here in the state of Ohio. And the pooling also is something that could be a very big game changer. So this is evolving every single day, and we're pushing and pushing because we know we're at about 22,000 tests a day now. We're averaging. That's not enough. I mean, it's double what it was and triple what it was, but it's not enough. We got to keep moving. So we'll try to keep everybody informed what we're doing.
Our next question is from Andy Chow at Ohio Public Radio and Television.
Hi, Governor. A question for you and also for Dr. Moeller. When we're talking about tests coming back inaccurate, is it more likely for a test to be false positive or false negative? And is one more concerning to you than the other?
Yeah, I'll just say the false positive was pretty concerning to me, but let me get Dr. Moeller on there. Doctor, you want to take that one?
Sure. So I think our goal is to ensure a few of either, depending on the type of test, and I won't get into too much of the science. Some have false positives and some have false negatives. Typically with the antigen test, it is typically a false negative, meaning that you test negative and then you have to go back and be tested again. And so I think we're obviously concerned with either, and because it impacts, whether it's the inconvenience of having to inappropriately, quarantine for 2 weeks or getting the wrong health information. So I think both are important to us. And as the governor mentioned before, those are the sorts of things that we think about before we would deploy massively a process. I will go back to the telescope and binoculars view because it was brought up. One's a good test and one's a bad test. Both are part of a toolbox, right? And we may need one that we can improve to serve a certain population and the other for another. So it's just really important that we keep our minds open and continue to innovate.
Thanks, Doctor.
Our next question is from Spencer Hickey at Hannah News Service.
Thank you. I'm glad to hear you've tested negative. Governor, could you talk about the president's Monday declaration that National Guard duty would be extended through the end of the year, but with most states picking up a 25% share?
Well, we're glad to have the extension. Obviously, we would have wanted the federal government to pay it all, but look, the Guard has played an integral role. I talk to General Harris every morning about where they're going, what they're doing. They played an important role in our nursing homes. They're certainly playing an important role out in our communities. So we're grateful for the extension. When we can get the federal government to pick up 3/4 the cost, that certainly is better than us taking the full cost. Frankly, we'd already made a decision. The federal government was not going to do that. We certainly would have extended, at least for a while, the Guard's mission, because it's so crucial. They have the ability to go out when we see a hot spot and a community wants us to come in. They have the ability to go there. And I would just say to any mayors, anybody in county commissioners, if you're looking, any director of health, if you think that you do not have enough testing in your community and you've got some challenges, talk to us, talk to the National Guard. We're happy to come in and do testing for a day. So happy to do that.
Governor, our next question is from James Pilcher at WKRC in Cincinnati.
Good afternoon, Governor. I want to switch topics for just a second and talk about evictions. Evictions are on the rise, and now that the $600 benefit is gone, a lot of people are facing even more evictions possibly at the end of this month. Some experts say that it's actually cheaper to keep people in their homes than evict them, where they'd be more apt to rely on social services. At this point, what are you prepared to do to keep the eviction rate down? And are you prepared to discuss an eviction moratorium in the state of Ohio?
Well, again, we're hoping to see some action, additional action in Congress that would be of some assistance to those individuals. We've all seen the stories. You've reported some of the stories of individuals who, cannot make their payment, their monthly rental payment. So we're looking at it. I don't have anything to announce today or really to add to it today, but it certainly is a concern to us as we move forward. But we're taking a look at it.
Our next question is from Kevin Landers at WBNS in Columbus.
Hello, Governor.
Hey, Kevin.
Glad to see you. My question is both for the governor and for the doctor. Did your PCR results show that you never had COVID? And did I understand that PCR tests don't provide either false positives or false negatives? And have you considered using the rainy day fund to help with evictions?
Don't know about the last yet. We're still looking at it. I will refer it to Dr. Moeller. The rest of the question.
Sure. So I can't help with the evictions, but I can help with the PCR test. So the testing for PCR is a snapshot in time. And so what the test looked at last night is the swab that was taken from an individual, is there RNA for the virus on that swab? It doesn't say, has he had it 3 weeks ago? It doesn't say what an individual might have 2 weeks from now. It is a snapshot in time test, and is something that, again, that's a limitation to a test that we think about as we plan our strategy, but it is, again, a snapshot in time.
Doctor, while it's a snapshot in time, could you elaborate on that a little bit? Because if someone comes down with it on one day, and then let's say 10 days later, I mean, is there a range in there that we would expect to find to get a positive? Is there any kind of guidelines for that?
Sure. So we know that we can detect the virus with a PCR test between about 1 to about 15 or 20 days. One of the things that we're working on now in the lab is how active is that virus as you get to some of those later stages. And so as our tests become more and more accurate, and I will say that for the researchers in the world out there, that no test is 100%. No test is ever going to be 100%, but pretty darn close. We're looking to see, how early can we detect it, and then how far does it go out? And what we're trying to figure out, Governor, is maybe once you get past day 14 or 15, that you can detect virus by PCR, but maybe it's not as active, or maybe you can't spread it as well. So it's there, but it may be dead. So those are the sorts of questions that we're trying to figure out right now in the lab.
Okay, thank you. Thank you very much.
Our next question is from Justin Dennis at mahoningmatters.com.
Good afternoon, Governor. We're glad to hear you're in good health after your test results yesterday were negative. Along those lines, we'd like to know when the public might have access to such rapid PCR testing with results returned within hours. Currently, they seem reserved for public officials and well-paid professional athletes. And I've recently spoken with Ohioans across the state who say people are still waiting more than a week for results. My colleague here at Mahoning Matters just this week waited 4 days. What can you say to those people?
Yeah, what we can say is we're doing everything we can to increase the time. Look, we have two challenges. I say we collectively as a state. One is we're not doing enough tests, and we've got to continue to expand that out. The second, while some tests are coming back within a day, 2 days, which I think is reasonable, other tests are taking a lot longer to come back. Some of the tests that are historically in the last few months have been taking the longest have been where we have national companies and they just get backed up. And so somebody enters into a contract with a national company, they're supposed to get it back in 2 days and they end up getting it back in 5 days or back in 6 days. So it is not a uniform testing in the state of Ohio. There's a lot of different players, a lot of different hospitals. And so let me ask Dr. Moeller if he can just shed some light on what you might be seeing at Ohio State, but also anecdotally maybe what you're hearing from other testing places in Ohio. Again, you have some hospitals that are doing testing. You've got places like UC. You've got the Cleveland Clinic. You got UH. You got Dayton Children's. We got a lot of hospitals that are doing testing, but we also have some private national labs that are doing as well. Doctor?
Yeah, so I would say that we have great partnerships here at Ohio State and Battelle to work with all the other labs across the state. And in fact, we do a lot of work where we communicate to maybe trade some of the tests so we can ensure rapid turnaround time. One point that we talked about, say 20 minutes ago, was this idea of pool testing. Pool testing is going to be absolutely key to being able to increase our turnaround time, or in fact, decrease our turnaround time. And so that would be something that would be fun to continue to talk about. But some of the modeling that we look at that, where you're able to combine 1 in 5 or even 1 in 10 samples, is going to be able to decrease not only turnaround time, but really the cost, as well as some of these issues with reagent supply. And again, Doctor, one of the things we've seen, you just referenced, is reagents. Frankly, some of the labs in the state of Ohio are being kind of strangled, if I could use that term, because the people they have their machines and they're sending in the reagent, and they need to be sending the reagent to Florida or Texas or somewhere else. And so they're rationing. So our labs, many of our labs are being literally rationed. That's why we're constantly looking for other opportunities. I just got a call about another possible opportunity right before I came on the air here. So I don't know if you want to add anything to that, Doctor, or not. No, I'd say the only thing that we continue to work with the CDC and the FDA across the state labs to figure out if there's ways that we can continue to expand our equipment and reagent pool. And in fact, we have a project now that we're working on the FDA with, is to be able to allow us to use some of the not so fancy telescopes that might be in college or university labs that they're using for teaching or using for some very basic research, and redeploy those to be able to test. And those conversations are very active and will again help our supply chain and turnaround times.
And those conversations, Doctor, I find very exciting. We'll have to see how this pans out, but this has great possibilities, not just for Ohio State, but for many other universities, and some even not so big in the state of Ohio, who have laboratories, and that we might be able to deploy them in this battle, in this war. So it's very, very exciting. And again, that was one of the things that we were discussing when Dr. Birx was out a couple of weeks ago. We discussed that with her, and I know that Ohio State has been looking at that for some time. So.
Your next question is from Dave Sess at WKBN in Youngstown.
Hey, Governor, how has this experience influenced how you consider health orders, whether it be towards schools, churches, bars, or even Ohioans?
Well, I think from a personal point of view, being informed yesterday about 11 o'clock that I had the COVID, it does center your attention and it focuses your attention. And, I've studied this enough. I'm not an expert, I'm not a doctor, I'm not a scientist, but you sort of know what your odds are. And even for a 73-year-old, the odds are pretty good, but the risk level obviously goes up because of age, because of the fact that, I have asthma. So yeah, it focuses your attention, and my attention's been focused on this, but I think when it becomes personal, you think about it and you think of, I think you understand better, I understood better, how other people feel when they're told they have COVID, and when they're told, hey, this is what you got to do, this is what may happen. I think it brings home the gravity of it in a very, very, very personal way.
Next question is from Adrian Robbins at WCMH in Columbus.
Hi, Governor. Thank you again for being here, and I'm glad to hear that you're doing well. The White House continues to worry about these new kind of outbreaks we're seeing in rural areas. Earlier this week, they even brought up Ohio as an example of these outbreaks. You also sound like you're concerned about this. What are your experts saying about this kind of spread in rural Ohio, and what can be done to combat it?
Yeah, what the experts are saying, Dr. Birx, who was in here, as I said a couple weeks ago, and what we're seeing in some other states is the spread into rural areas is not unique to Ohio, first of all. The spring, March onward, many rural areas felt like they were untouched. They may have had some cases, but you didn't know very many. If you lived there, you probably didn't know anybody that had it, or certainly no one had died from it. That's not going to be what is happening. It's not what's happening now in Ohio. We're into a very different spread. It's a deeper spread. It's a more comprehensive spread. It is out into our rural areas. And the rural areas who are yellow, the counties that were yellow on that map, they got to fight hard to stay yellow because we've seen so many of the yellow counties over the last few weeks turn orange. So it's a real battle, but it comes back to basics. It comes back to distance, mask, sanitation, be careful. It just comes back to basics. And the people in the counties that we're worried about, those top 10 counties, they have it within their own control. We've told their local health department, whatever you need, we're going to give to you. What do you need from us? But the most important thing that can happen is for people in those counties to put masks on when they go out in public, to keep a distance, to understand when they're celebrating a happy event or in sorrow in a funeral, that their lives are still at risk. And, even though they're among friends, even though they're among family, that because so many people have no symptoms but are carrying the virus, they got to be careful no matter who they're around. And so that's what will stop it in the rural areas. The people in the rural areas can control it. And I'll say this, in rural areas, most schools are planning on going back in person. How long those schools are able to go back in person will be determined by not only what the school officials do, and I am every confidence that they're going to do a great job, but it's also what the people in the community do and how much community spread there is. Because when there is community spread, you cannot keep it out of your school because kids are going in there and they're mixing with other kids, and it's a accelerator. And you're going to see the spread more. So if we want our schools to stay open, if we want to be able to go in person, which is what we want to see for our kids, the community has got to look at wearing a mask as a direct impact on how long that school stays open and how long the football team is able to play and how long the band is able to play and how long all the other things that we want to do connected with our schools is able to take place. It is a direct connection. It is a direct connection. And so I just would appeal to all of my friends, wherever you live in Ohio, what you do is going to determine how long the kids are in school.
Next question is from Max Philby at the Columbus Dispatch.
Hi, Governor. Glad to see you're doing well today. But given yesterday's COVID scare, what kind of protocols are in place if you were to become seriously ill with the virus? How would some of these decisions around, health orders and other things get made?
I would make the decisions as long as I could. If I got to the point where I could not make the decisions, and I will know, I'll guarantee you. Then Lieutenant Governor, John Husted is in charge. Whether I'm making the decisions or John is making the decisions, we have a stellar team around us. It's a team that's been with me many, many years at the top level. These are people I implicitly trust. Some of them were with me in the United States Senate. They've been with me, the AG's office, with me now. So we have a very, very good team. We have people outside the administration that we consult all the time. So, this is not a case where the Lieutenant Governor, is sitting over here and he does a little something. That's not the case at all. This Lieutenant Governor is involved in virtually every decision we make. Very, very much so. Adds a great deal. I'm very lucky to have him. So I think people of the state can feel confident that something happens to me, the state will move forward.
Our next question is from John London at WLWT in Cincinnati.
Governor, I know you just talked about schools just a second ago, but reopening them remains very high interest and very controversial, maybe more so since the mask mandate for all students. I'm wondering what a successful school year looks like for you, and is there a threshold where you'd order schools closed again? And if so, would that be district by district or a statewide blanket?
Well, John, I think it depends on the facts. This is all going to be fact driven. Yes, you're right. It was controversial. I've talked to a lot of people about the mandatory mask order. Again, there are exceptions, and if someone can't wear them, that's fine, and they should not, be criticized in any way. That's fine. But every health professional I have talked to, every doctor who I've talked to said the wearing of masks in school not only can take place at a young age, but should take place at a young age. I trust the teachers. The teachers will figure this out. If there's some reason a child can't wear it, that's going to be okay. If the child is having problems, that's okay. Teachers will work it out. I trust our teachers to do that. But I said at the time, our chance of getting through school, getting school open, kids physically there, and keeping that going for an extended period of time is going to be in a direct relationship to two things. One, what's going on inside that school, and are the students wearing masks, and are they social distancing, and is everybody doing what they need to do? The picture we saw coming out of Georgia, for example, is not what we want to see, and I trust that you will not see a picture like that coming out of Ohio, where everybody was crowded together in the hallway and no one seemed to be wearing a mask. So that's one. Two is what happens to the community. The community is going to control the future a lot, because you cannot separate the community from the school. And the spread that goes on in the community will be in that school. And you can pretty much mathematically figure out what it is. In fact, you can go up on a webpage and look at some projections. So what we do in the community, what we do in school. And look, the first people who are going to know there's a problem in a school are the people in that school. And just as schools get closed during the school year, if there is flu, if there's COVID and flu, COVID, you're going to see school systems make those decisions. They're going to make them on the spot. They're going to make them in the best interest of the people of the community, and I trust them to do that. Could there come a time when it is so bad and so dangerous that, yeah, we think we have to close, schools in one area of the state or schools in the whole state? Well, I suppose that's a possibility, but we're not going to get there until we see what the facts are. This virus has a mind of its own. We have no idea how it's going to progress. There seems to be a consensus, at least in the national experts that I've talked to, that would indicate that November, December, January could be tough. Our first hurdle is going to be going back to school. We are now down to about 5.5% statewide positivity, higher than we would like, lower than it was 3 weeks ago when it was 6.5. So we're not going in at a real high level, but we're certainly not going in at a low level. We wish we were starting going back to school at a lower level, but we're not. It is what it is today. But again, I would plead with everyone out there. We've got a couple of weeks for most areas of the state before school starts. Do everything you can, drive these numbers down, slow this thing down, because when school starts, we're going to see naturally, we would expect to see an uptick. Now, if everyone wears masks, if everyone social distances, and if in times when school's out, people are focused on it, yeah, we can slow this down immensely. So, John, we're just going to take it day at a time. We're going to keep in touch with what's going on in our schools, but the first line of defense is going to be out there with those superintendents, those school boards, those principals, and those teachers.
Next question is from Molly Koweek at WHIO in Dayton.
Hi, Governor. You had two different types of tests, an antigen and a PCR, but you, of course, got different results. Does the state track its testing data by separating it by the type of test? And how can Ohioans feel confident with the data that's being released daily?
They can feel confident in the data that's released daily because that is fundamentally the PCR data. As we said, we think about 1.3 million Ohioans, 1.3 million tests have been done, and those are the PCR tests. The vast majority of those are. There is a breakout on our webpage. We looked at that, frankly, a little more carefully. I looked at it maybe a little more carefully, and it looks like the second section, which is the non-PCR, probably needs to be broken out better. So we're working on that. But the key factor is, if you're watching this and you've had a test in Ohio, the odds are very, very heavy. It was PCR test, which is state of the art, and that's what you had.
Thank you.
Our next question is from Jake Zuckerman at the Ohio Capitol Journal. We will come back to Jake. Our next question is from Jesse Balmert at the Cincinnati Enquirer.
Hi, thanks. My question, I guess, is about the Ohio Department of Health data that is, some of which is in a system that's 19 years old. I guess, what's the first step into improving that system, and how difficult will that be with the state's current financial situation amid coronavirus?
Look, we're going to do what we have to do. The problem is we're also in the middle of a pandemic, and it's all hands on deck now to deal with the pandemic. So we know that to fix this system, it's probably to permanently fix it, to get a new system, start with that. To get a new system, it's going to take longer than this pandemic we hope lasts. But that's what we're going to strive for. We're going to do it right. Look, we're going to have other things that we need to track. We hope we don't have anything like this for another 100 years, but we don't know that. We have to be prepared. So yeah, we'll invest what we need to invest because this is essential, and it's an area that frankly has been underinvested in.
Do we have Jake Zuckerman from Ohio Capitol Journal?
Am I coming through here? Do I have sound?
We can hear you.
Okay. Governor, sorry about that. Ohio tested about 22,000 people per day in July, and the Ohio Department of Health told the federal government it plans to PCR test just about 24,000 people per day in August. So the growth is pretty modest there. We're about 7 months into this pandemic. Why is Ohio still failing to scale up its testing, and what are the choke points?
Yeah, we're not failing to scale up our testing. We've scaled it up. That's one. Second, when I saw what our department, they told me what they're reporting. I said, that's not acceptable. I said, you can send that in, but that's not what our goal is. So that is not acceptable. Those numbers are simply not acceptable. Now let's look at the big picture. New virus, health departments not had invested in health departments, not invested in the testing. So this thing started basically from zero when this pandemic hit. We have fortunately never been a state that's been tops or even in the top third, I don't think. We controlled it going in. We're controlling it coming out, not as well as we like, but we are controlling it and we're not a hot spot. We never were New York. God love them. We never were Florida. We never were Texas. But what that has meant is that we've never been a priority. Very understandably, when the federal government makes decisions about allocation and they indicate to different companies, we're never a priority. Now we've got good cooperation from the federal government, good cooperation from the Trump administration, but we're never a priority, and that's good in the sense that we never were that bad. So that's one of the things. We've not ever been on fire here in Ohio, and we don't want to be on fire. Second, we have worked to increase the capacity. There's no testing system in Ohio. We have a whole bunch of labs, and what we have tried to do is do a couple things. One is we've gone out on the market and bought lab capacity from companies, and at the same time we have been building up our own system. We got a couple things that we're very excited about. We're building up what we call our central lab, which is not just in one place, but it's in other labs. We have a working relationship, for example, with Dayton Children's Hospital, and they have taken a part of their facilities in Middletown and turning it now into a lab. So that figure that you quoted early on, my goal is to certainly exceed that and keep moving. So Eric has given me the sign. We're ready to get off. So I want to thank everybody very, very much. And we look forward to seeing you back on Tuesday. Fran and I will get these tests tomorrow. We'll report those tests out in a news release as soon as we have results from tomorrow. Have a good weekend, everybody. Thank you.